Madam Speaker, I rise today to share with you a very powerful story from my home state of Colorado, but this story could be from San Francisco, California, it could be from Austin, Texas, it could be from Salt Lake City, Utah. Carol from Denver is a single mom with 2 kids. Carol became disabled about 12 years ago while she was working at Burlington Northern Railroad. Because of that injury, in part, as one of the reasons that led to her divorce, because it became very hard for her and her husband. Carol got Kaiser Connections coverage through her church, but that only lasted 2 years. And as soon as she had the coverage, she went in for severe headaches, and they found a brain tumor. Carol had surgery on the brain tumor, but they weren't able to remove all of it. And as soon as her 2 years were up, she was dropped. And of course, she was unable to get new coverage because of the scarlet letter that far too Americans wear, pre-existing conditions. Carol was still undergoing treatment when they dropped her, and she couldn't continue taking the medicines that they had her on for seizures that were also causing her headaches. Also, 2 months after her brain surgery, her ex-husband passed away. Now she's the only one that is there to support her 11-year-old son. Carol tried getting coverage through a public-private partnership in Colorado that wanted about $500 a month. That would be almost half of her income. She makes just over $1,000 a month. You can't afford that. Rent, food, gas, no extra money. Try surviving on $1,000 a month. How are you going to spend $500 a month on health care? Carol shared with me that she's desperate to get health care coverage, but she feels she keeps hitting a brick wall. Carol says, if there's anything to this health care reform that could help me at this time, I'd be forever grateful. Carol, there is. And I call upon my colleagues in the House of Representatives to pass health care reform. What would it mean for Carol? Well, at her income level, she would receive affordability credits. That's effectively a voucher that she'd be able to take to the insurance provider of her choice, and that would basically pay for the cost of health care insurance. Those affordability credits are on a sliding scale, so for a family of 2, they go up to about $45,000 a year in income. So even if you're making $35,000 or $40,000, you still get some affordability credits, but at $12,000 or $15,000, they basically cover about 100% of the cost of health care. Now, that's not just any health care, that's health care through the exchange, which is a low-cost option for anybody who's self-employed, buying insurance on their own, small companies. That'll give Carol a choice of dozens, perhaps even hundreds, of insurance options in that exchange, one of which would be the public option. The others would be a plethora of private options that she would have the choice to choose. Health insurance today is unattainable for Carol and 45 million other Americans like her. By passing health care reform, we can help Carol and her family and her 11-year-old son have a mother as he grows up. That's the face of health care reform. As my colleagues cast their votes on health care reform in the coming weeks, I encourage them to remember Carol and her story and the millions of others like her across this country. Thank you, Madam Speaker.